Welcome back to WMBC News. Heart disease is the leading cause of death for both men and women in the United States. Joining me today is Dr. Manish Bhalodia. He's a cardiologist. Dr. Bhalodia, thank you so much for joining us.
Thank you for having me here, Ms. Avni.
Every 40 seconds, someone dies of a heart attack. Given the advancements in treatments and prevention, why are the statistics so alarming?
Well, the main reason the statistics are still alarming is our lifestyle. The diet and the exercise that we have gotten used to has the biggest impact on where we are. And that's why, in spite of all the progress is made in medicine, we still see that people have not changed their diet and lifestyle as much that we should have expected by now.
So what specifically about the diet should we change?
Fresh food, fruit, vegetables, and nuts as much as possible. And avoid processed food. Anything that is processed that is supposed to be bad for you. That's my biggest takeaway for that diet, is avoiding processed food.
And, talking about preventing heart disease, now I know there are things we can do to prevent it. How do you reverse some of the effects of heart disease?
So you have to make sure that the same lifestyle changes helps you preventing. You have to use the same lifestyle to aggressively use them in terms of diet, exercise. The biggest thing is the lack of physical activity that we have gotten used to. That's what along with the diet and physical exercise, we have to enforce that strictly to make sure that you're regressing the disease and not making it go forward.
Let's talk about some of the risk factors for heart disease now. There are risk factors that we can control and there are risk factors that we can't. But the factors that we can control, what are they?
So there are many factors. That's basically genetics you cannot control. You cannot choose your parents, obviously, but your lifestyle includes diet, exercise, cholesterol, and your obesity, the weight control. Those are the biggest risk factors that we can control in terms of how to manage your heart health and overall general health also.
So how do we control our blood pressure, our cholesterol, and sugar?
So each one has their own particular things that you can. So for blood pressure, generally, sodium control, so making sure that you don't utilize extra salt in your diet, avoid processed food as much as possible. Also, adequate sleep is very important. A lot of people underestimate the need for sleep. Need for caffeine also increases your blood pressure. So if you increase the caffeine, the blood pressure goes up significantly. In terms of diabetes, cutting down the sugar in your diet. So eliminating sugar is the biggest risk factor in terms of managing your diabetes. And along with that, you need to make sure that you increase your activity. So make sure that you exercise at least 30 minutes a day or get involved in any kind of sports.
I want to talk about the antioxidants and the role it has in reducing the heart disease.
That's a great point. So antioxidants prevent the oxidative stress that happens in your body. So oxidative stress happens when your diet is with a lot of red meat, a lot of processed food. What it does is causes inflammation in your system. Inflammation is at the core of the plaque buildup. So when there is significant plaque buildup, that's when somebody gets heart attack. So antioxidants obviously prevent this oxidation and prevents your body from getting atherosclerosis.
I want to talk about your practice. You are a cardiologist. You see patients on a regular day-to-day basis. What is the common denominator that you see among all of your patients?
It's strange because the common denominator that I find right now is most patients are presenting with stress. That stress is the underlying denominator for every single person. Is a 20-year or whether it's 90-year-old person. And that has got to do with the lifestyle. And that affects their lifestyle. So stress being the underlying factor, that changes their dietary habits, and that also changes their exercise routine.
Dr. Bhalodia, thank you so much for joining us.
Thank you. It's a pleasure.
WMBC News will be right back.